Today is actually a men's episode, and the topic is very touching. It's female cystitis. After sexual intercourse, you may not have any sexually transmitted infections, and maybe you've never had them at all. But every time you have sex with your wife, she develops cystitis. She suffers, she's in pain, and she starts taking uroseptics and antibiotics. For years, she tries to treat it, but nothing works. In today's episode, I'll explain the cause of this cystitis. Because you are actually healthy, and the reason is not you, and I'll tell you how to help your wife. Why did I decide to make a video on this topic? Because wives constantly send their husbands to my office and say, cure him. Every time after sex we have a problem, I get a flare-up, cystitis, and our sex life stops for a week or two. And as soon as we start having sex again, we do it once or twice. And right after the next sexual intercourse, I have another flare-up. I have to take antibiotics. I have to take anti-inflammatory drugs. I live with cystitis. It's already affecting my mental health, and now I'm afraid of sex. They even start refusing sex because they have a pathological fear of getting cystitis. So what is cystitis? Cystitis is inflammation of the bladder wall. It happens, but why don't men get it? In 99% of cases, it's actually prostatitis in men. In women, the urethra is short, so it's much easier for any infection to get into the bladder. Most cases of cystitis, I would even say almost all cases, are not caused by sexually transmitted infections, but by E. coli. And that's why there's not much point in fighting it, because it's part of the normal flora in the vagina, and it's also part of the normal flora in the rectum. And you don't need to have anal sex for this to happen. You don't need to have any special sexual practices for this to occur. For you to develop cystitis, the question is why some women get cystitis after sexual intercourse and others don't. It all actually comes down to anatomical features. They can be congenital or they can be acquired. How can you tell if this is congenital and what does it involve? In some women, the urethra is dystopic, meaning it is located somewhere other than where it should be according to normal anatomy. It is shifted toward the vagina, meaning it is shorter and displaced toward the vagina. And when you have sex, you act like a piston, pushing all this fluid from the vagina and forcing it into the urethra. Naturally, there is E. coli there and contamination occurs. So yes, this anatomical feature is common for many people, but when it's combined with a not so strong immune system, cystitis develops, inflammation in the bladder, and this is specifically called postcoital cystitis. Coitus means sexual intercourse, and postcoital means it occurs after intercourse. If your wife has a clear connection between developing cystitis and sexual activity, you definitely need to take her to a good specialist who will examine her urethra. The first feature is that the urethra is initially located a little bit off, a bit deeper than it should be. The second feature is when it is located where it should be. But it is hypermobile, and during intercourse it turns into the vagina, it turns in, and the same thing happens. There is even a syndrome called O'Donnell-Hirschhorn, when a doctor, wearing gloves or using an artificial phallus, simulates intercourse and observes what happens to the urethra. Because just by looking at it, it might be where it needs to be. But when testing for Hirschhorn-O'Donnell syndrome, there is an unusual symptom where the urethra turns inward into the vagina. This can be congenital. If a girl is sexually active and starts having cystitis, and all of this happens at the same time, you should consider whether there might actually be some kind of congenital pathology. Sometimes, unfortunately, defloration occurs, and the very first partner causes a rather traumatic defloration, possibly with injury to the urethra, which leads to this. Sometimes a woman can have a sexual life for 10, 5, 15, or even 20 years. And suddenly, after a certain point, even though her anatomy has always been the same, she starts developing postcoital cystitis. Her immunity is not as strong as it used to be, and in her case, this recommendation becomes enough. There are women who develop these symptoms after giving birth. So you and your wife lived together for 5-10 years and everything was fine? But after she gave birth, especially if it was a traumatic or complicated delivery, Hirschhorn syndrome can develop. So what should be done then? There are several treatment options. Probably the simplest thing to start with is the injection of a volume-forming gel. When the diagnosis is confirmed, hyaluronic acid is injected. A small ridge is created next to the urethra, which makes it harder for all that external flora to get inside. It's minimally invasive and a good starting point, but it doesn't help everyone. If it doesn't work, what should be done next? The only way to treat postcoital cystitis, if this doesn't help, is surgery. The surgery is called urethral transposition, and I perform this operation using the classic technique. What happens during the procedure? The urethra is isolated, a new exit opening is formed, and this urethra is moved to a different location, meaning from a deeper position. You bring it outward, closer to the clitoris, and fix it in place. In most cases, this allows you to resolve postcoital cystitis and relieve the woman of the problem. Because women often go to doctors and have their urine cultured, there is always Escherichia coli present. Escherichia coli is also known as the intestinal bacillus, and they are constantly given not treatment but relief from symptoms. They are given medications. Take the powder, it will relieve you from cystitis. Of course it will kill the bacteria, but they will come back, because the root cause hasn't gone anywhere. That's the first thing. And the second. What's important to know is that it's impossible to get rid of Escherichia coli because it's always with you, and if there are anatomical features, it will continue to get in. Third, the issue isn't whether you can live comfortably with it. Maybe someone will say, well, okay, it happens, I get cystitis, I take antibiotics, yes, fine, but every flare-up of cystitis, every inflammation of the bladder wall will lead to a significantly increased risk of developing certain inflammation-associated diseases, up to the development of a condition where the capacity of the bladder decreases. For example, interstitial cystitis, which is quite difficult to cure. Therefore, if you don't have any sexually transmitted infections, you are faithful to your spouse, you've never been diagnosed with anything except E. coli, but your sex life still suffers because of this. Send your spouse to a good urologist who will examine her urethra, determine if she has the Hirschhorn-O'Donnell syndrome, and if necessary, if the injection of a bulking gel is ineffective, will perform a surgery that will radically change her life in just one day. So, stay healthy, take care of your wives, and get proper treatment.